Years ago, premature babies born in the Central Valley were often separated from their mothers and sent hours away for specialized care. Now, the newly renamed Rajani Family NICU at both Community Regional and Clovis Community are reflecting a decades-long mission to keep babies and their families close. When Dr. Rajani first came to Fresno to practice medicine, he noticed babies needing specialized care in a Neonatal Intensive Care Unit, or NICU, couldn't receive this care and were often transferred as far away as San Francisco or Los Angeles.
Our group was taking care of babies in 4 or 5 hospitals. And yet we're still transferring babies, for higher level of care. To give you an idea, in 2008, 2009, we delivered 9,000 babies in this hospital downtown. Now think about that. We're creating a kindergarten class every day, and we're transferring about 450 babies, to other hospitals. So again, it's not good for the quality of care for the babies. It increases the morbidity and complication rates. Finally, the hospital came up and realized that, this was not the best form of practicing medicine with these tiny babies.
He knew that had to change, and it did because of his work and so many others over the last few decades.
I respect, everybody who is contributing to the success of this unit. It's the board of trustees, the administration, the nursing staff, the respiratory therapists, the janitors, environmental services, the clerks.
With dedicated work and collaboration, the Rajani family helped build both NICUs to what they are today, providing the highest quality care to our tiniest patients.
This is not a one-person job, so it's a whole team, between the maternal fetal medicine, neonatologists, and the ancillary staff such as the NICU nurses, NICU respiratory therapists, and ultrasonographers, radiologists, surgeons, so on and so forth.
Dr. Rajani's son, Anand, is also a physician and current medical director of Community Regional's NICU.
I think having our name on the NICU creates an immense sense of pride. So this is a product of our family's, our life's work, though in some ways it's somewhat misleading because we couldn't do this without so many other people who work alongside us in the NICU. And there are so many folks who've put in so much time and they have sacrificed so much, both from their families and from their other interests, in order to help us materialize what we have today. So I think we owe everybody who's been a part and who's contributed to creating this NICU a great deal of thanks.
Dr. Rajani said he remembers his father sleeping at the NICU every other night for years. His dedication, his commitment to his patients and families so they'd have the best of care.
He had a mission, and the mission was to improve family-centered care and to keep mothers and babies together.
The Rajani family has long supported community with time, expertise, donations, and even scholarships for nurses, all to make the NICUs what they are today, one of the highest levels of care for babies in this region.
So to me, to be part of this journey and to be able to create a resource that otherwise didn't exist here in Central California is a huge source of pride, because without that, I'm not sure what a lot of these families would have done.